Hello, and welcome to Chapter 13, Clinical Evaluation Process in Nursing Education. Let me go ahead and share my screen. There we go. So in this chapter, we are going to look at a comprehensive guide to evaluating nursing students in the clinical setting, focusing on assessment methods, feedback techniques, and competencies. All right, so key outcomes of clinical practice: knowledge acquisition. They have to understand concepts, theories, basic knowledge necessary for clinical practice in diverse healthcare settings. Evidence-based practice, they need to develop skills and to use research findings and other evidence to inform their decision-making process. And clinical judgment, clinical experiences foster higher level thinking abilities and enhance their clinical judgment skills, which is essential for complex patient care. These fundamental outcomes represent the cognitive foundations for nursing practice and ensure they develop intellectual capabilities needed to understand complex patient conditions and formulate appropriate care responses. So developing essential clinical skills competence, psychomotor skills, developing hands-on clinical skills, intervention that forms the backbone of nursing practice. Students demonstrate proficiency in procedures ranging from basic vital signs to complex treatments. Communication excellence. They need to be able to communicate effectively with patients, families, communities, and healthcare team members. And this includes verbal, nonverbal, written, electronic, all of that. And interprofessional collaboration. They learn to work within a team. They need to understand the various roles of the different providers within the team. And all of this is important in learning, taking your nursing theory and applying it to clinical and to bridge that gap. Patient-centered care outcomes. We need cultural competence. Students develop knowledge and attitudes necessary for providing appropriate care to patients from diverse backgrounds, recognizing how cultural factors influence health beliefs and practices. It helps them learn ethical decision-making. Clinical practice provides opportunities to encounter ethical dilemmas and develop frameworks for resolving them. And quality and safety focus, of course, being in clinical helps them acquire knowledge and skills, and also look at continuous healthcare improvement, improving healthcare quality, improving healthcare safety, prevent medication errors, stuff like that. Professional identity formation. So in the clinical setting, they start to develop their professional identity. They begin to internalize nursing values and develop a sense of their profession through clinical. They'll start to eventually embrace leadership, recognize personal accountability, committing to career-long growth. As they progress through clinicals, they should increasingly exhibit these qualities, moving from tentative practice, like think of your first semester students who are afraid to go in the room at all, to confident professional behavior, think of them now taking vital signs by 6th semester, right? They're confident and comfortable. They go in the room, they know what they're doing. So that progression happens through being in clinical. Understanding clinical evaluation. Clinical evaluation is very subjective, and it's based off of the instructor's observations, values, and owned clinical judgment. The key to fairness in applying consistent standards in clinical assessment is to be aware of your personal biases and focus on predetermined competencies for evaluation, not personality traits. So very important. You might have a student who just isn't your favorite, honestly, for whatever reason. But you can't let that color the lens that you're looking through in terms of assessment. They might not be your favorite person or your favorite student, but that's not what you're judging them on. You are evaluating their clinical skills. Or you might love this student, like you relate to them, they make you laugh, whatever it is, you just adore the student. But you have to assess their clinical skills, not their personality, but their clinical skills. Evaluation versus grading. So clinical evaluation, that's the process where the teachers observe performance and collect data. They're related processes, but they serve a different purpose. Evaluation is more broad. It's a broader process of assessing student performance against standards, whereas grading is assigning a specific symbol to represent the outcome. Clinical evaluation standards, norm versus criterion referenced. Norm reference standards compares the student's performance to that of other students in the group. It's the same as testing. I think we went over it in chapter 1, not testing, just evaluation. I think it was chapter 1. Norm and criterion based. So the norm is comparing the students against other students, whereas criterion based is compares the students to predetermined criteria. Okay. The norm referenced has more to do with what the student knows, their knowledge, skill, or ability, where in relation to where their peers are in that stage as well. And the criterion focus, the criterion referenced focuses on if they've achieved specific clinical standards or competencies. Back to formative and summative. So formative clinical evaluation, it serves like for diagnostic purposes. It offers feedback in the learning process to guide improvement. It focuses on helping the students identify their strengths and weaknesses without the pressure of a grade. It's ongoing. It's an ongoing evaluation, and it gives the students opportunities to adjust their performance before a summative evaluation. The summative evaluation, that's at the end. It's a comprehensive assessment. So overall, at the end point, did they achieve their clinical competencies? At the end of the learning period, did they meet their objectives? And then you assign a grade to that. Ensuring fairness in clinical, just self-awareness. You have to, as an instructor, we kind of touched on this, but identify your own values, attitudes, beliefs, biases that may influence evaluation. Structured evaluation framework, have clear criteria on what you're going to be evaluating them on to try and take away some of that bias. And really try and encourage a supportive learning environment where they are able to come to you, able to talk to you without fear, a safe place to learn, to receive feedback. It's good to be professional, but at the same time, you want to be able to have students, you need to be relatable. They need to feel a connection to you, that they can come to you, especially in a clinical setting, where you're working closer with them and you're really evaluating the application of their knowledge. You don't want to be really standoffish and hard and like inapproachable. You want to be very approachable and really a more personal time with the student to feel comfortable and yet professional. You stay professional. You aren't their friend, you're still their professor, but approachable and kind. Where if they make a mistake or if they do give a wrong rationale, something like that, they're not reprimanded or made to feel stupid. They're just redirected and encouraged. Sources of student stress in clinical evaluations, fear of patient harm and making mistakes. They're very worried about that, huh? So am I as a clinical instructor. Knowledge gaps, they worry about not having the knowledge necessary to take care of patients and to do it safely. Observational anxiety from the instructor. It gives them extra anxiety if you're there watching them, although you need to be. And that's where that rapport comes in again. Being safe, a safe person, will help decrease their anxiety of you being with them. Staff interactions, family interactions, that's definitely also a source of stress. Learning how to interact with family, learning how to interact with staff. And just unpredictable situations that happen in clinical. It is unpredictable. You never know what a day is going to bring. You might have a plan, but clinical doesn't always follow that plan. So that can create a source of stress as well. So just kind of understand that although it might be a fun, like they're excited to go to clinical, it's also very stressful. And if you look at each of these areas, how can you be an effective instructor, but also make evaluation less stressful for them? The public nature of clinical learning, students, they're on public display. You can't hide knowledge or skills deficit. Errors and mistakes are going to happen. Hopefully not like a big med error or anything like that, but there's going to come a moment, even if it's something like doing a catheter and they forget to do a step, or the catheter touches the patient's leg. You can't let them then cath the patient. So there are going to be situations that arise along the way, and that's just how it is. We're going to have to stop. We're going to have to explain to the patient, okay, this didn't go quite as planned. I'm just going to grab another one, go out to the nurse, ask for another kit. So just letting the student know, hey, we've all been there. It's okay. It's just a cath kit. Do it again. No big deal. So what are we going to do different this time? And again, just making them feel safe about that. Being a learner versus a nurse, they're still developing competence, but they may face high expectations. So there's oftentimes they often have insufficient time to practice and refine something to be like nurse level at it when they're in clinical. And having the nurses understand that as well. You know, we've been, this is their second day in OB. So they are not super proficient at reading rhythm strips yet. But we have gone over it, and this is what they should know at this point. But helping them through that would be a big help, something like that. And supportive learning, just to stay supportive. Effective clinical feedback, be precise and specific. Feedback like, good job, doesn't really help them. What was good? What did I do that was good? What did I do that wasn't so good? So be specific and precise. Give it right away if possible. Make it individualized, and if you can, provide multiple modalities, like while you're speaking, give a visual or something like that. So for example, if I say, okay, so when you're going to insert the catheter on a pregnant patient, you're going to need to clean the area with the little stick thing and clean it front to back, one on each side, and then down the middle. Or I can speak that while I'm demonstrating. So make sure you hold it open and you use the little stick thing, and you clean down one side, throw it away. Clean down the other side, throw it away. One down the middle, throw it away. I mean, it's not a big difference, but it is. It is just providing the little hand motions or something like that is helpful. Okay. Defining clinical outcomes and competencies. Just make sure that you have specific enough outcomes and competencies listed so that you can definitively say, yes, you did this, or no, you didn't. Allow for flexibility in the patient care while also being able to meet those objectives and outcomes. Make sure they're fair and consistent and clear. Okay. Designing clinical learning outcomes, a program-wide outcomes. These are common outcomes used throughout the nursing program, throughout the curriculum, and how they're progressively achieved at each level. Course, and then you have course specific outcomes for clinical. So for example, the clinical outcomes in OB are going to be different than the clinical outcomes in mental health. So you have course specific behaviors that are expected by the end of that semester, but you also have program wide expectations and clinicals that are expected by the end of the program. Defining clinical competencies, make sure you use all three domains. All three domains should be within that evaluation of your clinical competencies. Psychomotor, are they able to do the task? Affective, are they able to stay ethical? Were they safe? Were they culturally sensitive? And then cognitive, did they know their material? Were they able to go from theory to application? Could they prioritize patient care? Things like that. So make sure you're assessing all the domains when you're assessing in clinical, not just one. Okay. So comprehensive purposes of clinical evaluation. Identify your existing competencies at the beginning of the clinical experience and recognize the student's strengths, the learning needs, the progress, judgments. The final judgment about whether students have achieved the required competencies, you should know this before the last day. So you should know as you're going through clinical with them, are they progressing? Are they looking like they're going to be able to meet these final outcomes? And if not, where are they struggling and what can we do about this? Don't wait until the very end and say, wow, yeah, you just didn't make it. Like you just aren't doing well. That should be a conversation you have ongoing throughout their clinical time. It shouldn't be a surprise at the end. And that's all for chapter 13. I will see you in another chapter.